When health plans face challenges, Diversified Group provides solutions. And solutions are what you'll find when you tune in to Healthcare Uncensored Live, our podcast series that tackles the tough stuff employers are facing today. To join us, visit dgb-online.com and click on podcasts.
Good afternoon and welcome to Healthcare Uncensored Live, a podcast brought to you by Diversified Group. I'm Brooks Goodison, president of Diversified Group, and we're an independent third-party administrator firm based in Marlborough, Connecticut, which is just outside of Hartford. The purpose of our podcast is to address the many healthcare challenges that employers are facing today. Today's topic is one that's near and dear to my heart: specialty drug claims. Not a day goes by where we don't see these coming into play on employers' group health plans. And they're one of the biggest challenges that are facing employers today. So what are specialty drugs, and why are these claims so difficult for any business striving to provide high-quality health plans for their employees? Specialty drugs are simply drugs that are high-cost medications, and they usually treat complex chronic conditions like rheumatoid arthritis, multiple sclerosis, and things like that. They're often the drugs that you see on the evening news. Because many serious medical conditions are involved, these drugs can often require special handling and monitoring. And they need a certain level of expertise, which is critical. Depending on the medical condition involved, a specialty claim for one individual can cost hundreds of thousands of dollars per year. And unfortunately, those outrageous specialty drug claims have become far too ordinary in our industry. So, in our world, in our solution at Diversified Group, we want to help our clients manage these costs, and we use a program called PharmaSense. In simple terms, PharmaSense fights back against out-of-control specialty drug costs by pre-certifying and clinically managing all specialty prescription drugs. This process keeps many of the prescriptions from being authorized without any independent review. It also prevents physicians from circumventing the plan and submitting a claim against the medical plan. So our goals at Diversified is to treat the prescription drug claims like any other claim. We actually analyze it carefully, and then we look for a lower cost solution that will result in a high quality outcome for the patient while being financially responsible to the plan. To better help you understand the impact that specialty drug claims are having on today's health plans, let me share a story or two. So the first example involves a patient that is struggling with psoriatic arthritis who was given a prescription for Stelara, which could cost the plan anywhere between $128,000 and $256,000 a year, which is an extraordinary amount. So instead of authorizing the prescription for Stelara when it was presented, the Diversified team at PharmaSense recommended step therapy as a way to test other medications that might treat the symptoms at a lower cost and be equally as effective. Step therapy enabled the PharmaSense team to recommend 3 months of phototherapy followed by 3 months of systemic DMARD, a disease-modifying anti-rheumatic drug such as methotrexate or cyclosporin. Up to the time of step therapy, this option enabled the health plan to save $50,000 a year. If the therapy is completed without the patient experiencing the desired level of relief, the pre-certification requirements will have been met and the prescribing physician will prescribe Stelara or another appropriate specialty medication. Another case we recently handled with the PharmaSense team involved a patient who had MS, who had been receiving Ocrevus by infusion locally 2 times per year at an annual cost of $106,000 a year. In an effort to find a lower cost alternative to infusion, the PharmaSense team sought other providers. The first option involved transporting the patient to New Hampshire by limousine, where they have an infusion center that has open, transparent pricing. Including all transportation and $2,000 in cash for expense reimbursement, the total cost would have been $79,000, a savings to the plan of about $27,000. Finally, we determined that the patient could be flown to Grand Cayman for Ocrevus. Grand Cayman is a British island in the Caribbean and they are a tier 1 country for pharmacy, which means that they buy their drugs from the same place that the United States does. And we were able to get that Ocrevus infusion at a total cost annually of $53,000 a year. This includes the hotel, which is first-class accommodations on 7 Mile Beach, round-trip air travel, which would include for them and their spouse or loved one. And they were able to do this all for $53,000 a year, which saved 50% or $53,000 a year. So we would go from $106,000 a year to $53,000 a year, which is a massive savings, all in the name of helping the health plan save money on specialty pharmacy. One thing it's very important to know about the Cayman Islands for drugs is that these programs are totally voluntary. What's in it for the member is they get a little bit of a vacation. It's completely voluntary, and the plan will eliminate their out-of-pocket oftentimes. So if they have a $100 or a $500 copay for specialty drugs, if they choose to go to the Caymans for that drug, it waives their out-of-pocket, makes it so that they don't have to pay anything to go. And it's beautiful. You fly in usually on a Friday night. You're met at the airport by a driver. The driver picks you up, gives you a cell phone, gives you $200 in cash, and they take you right to your hotel where on 7 Mile Beach. It's a great place to stay. You spend the night. The driver comes to pick you up in the morning, takes you to the Da Vinci Center, which is directly across the street diagonally from the Ritz-Carlton in Grand Cayman on 7 Mile Beach. It's very high-end. I would say like Beverly Hills or Miami Beach type of a med spa location. Everyone's in a suit and tie or dress, a very nice presentation. You walk in, you meet with Dr. Kona, and you get your prescription, and you're on your way. We were down with a group of employers. I've been there myself, met with Dr. Kona, and one of the employers said, Dr. Kona, why do you sell us these drugs for so much less money? Dr. Kona looked puzzled, and I wasn't prepared for his answer, but Dr. Kona said, we're really not selling you these drugs for any kind of a great price. We're just selling you these drugs for what the rest of the world pays for them. He says it's only in the United States that you guys pay such high prices for these drugs. The room was silent after that. People were shocked. I think it's interesting too, because oftentimes if you're thinking about getting drugs outside of the United States, there's so much controversy about where do they come from? Do they come from China? Do they come from Bangladesh or some untoward location? The thing with the Caymans is it's a tier 1 country. They buy their drugs from the same place. It's a British colony. They buy their drugs from the same place that the Americans do. And it's first tier. And there's no sacrifice. So when we're getting rave reviews from the members, when they go there, they're treated first class. They're home on Sunday night. They think Dr. Kona is unbelievable, and they come home with rave reviews. So there's no sacrificing here. You get a little vacation, and you have no cost as the member out of the pocket most of the time, if that's what the plan allows. And the plan saves 50% normally on these drugs. It's a fantastic way to go if that's the type of program your company is interested in providing. We had a case where we had a very ill patient with chronic obstructive pulmonary disease, or COPD, which is a chronic respiratory failure situation. During the pre-certification process, a big pharmacy wanted to prior auth OFEV, which is a kinase inhibitor, which is used solely to treat a certain type of idiopathic pulmonary fibrosis. And during the pre-certification process, we found that this patient was very ill, but had absolutely no documentation that they had idiopathic pulmonary fibrosis at all. We consulted with our physician advisors. We have several services that we use, and we all agreed. There was unanimous clinical, non-biased agreement that the drug should not be pre-certified for this particular case. And when we reached back to the prescribing physician to confirm our findings, we did confirm that they did not have that disease, and so we denied the request for the drug. So what happened? They were taking the wrong drug to treat the condition, and it could have been life-threatening. This is not always about money. It's about quality outcomes. It's about the clinical validity of the process. This member could have been killed. On top of that, the expected cost of OFEV was estimated to be about $231,000 annually. So the cost was avoided. The member was not going to take the wrong drug. So that was a great outcome that we used during the PharmaSense program process to help members and plans get the right drug at the right time in the right place. While specialty drug prescriptions may represent a small percentage of all the prescriptions your employees need in a year, these prescriptions can represent a third or more of your overall drug spend. I hope we've provided a closer look at this problem, along with some insight and some of the steps we're taking to help employer groups take control of this unprecedented expense. If your plan is struggling with prescription costs, give me a call at 860-295-2376. And if you'd like to share this podcast with a colleague or a broker, you can visit our website at dgb-online.com and click on podcasts. I hope you'll join us for future podcasts, and I thank you for joining us today.
To learn more about self-funding, cost-plus pricing, and many other ways Diversified Group is helping employers better manage the risks and costs of employee health care, visit us at dgb-online.com today.